Hello friends, welcome back to my channel The Zone of Med, and today I am here with another amazing video about the triangles of neck. This is a part 2 video. If you haven't seen the part 1, I recommend you to see that video once. In this video we are going to cover our muscular triangle and the submental triangle that are the part of anterior triangle of neck, and we have already seen that the anterior triangle of neck consists of 4 triangles, that is muscular triangle, carotid triangle, submental triangle and digastric triangle. We have completed digastric triangle in part 1. Today we are going to see muscular triangle and submental triangle. So moving forward, in the muscular triangle, the things that are important for us to understand is first its boundaries, second its content. In the content, the main focus is basically on our infrahyoid muscles, and the infrahyoid muscles we have already learned that it is 4 in number, that is Sterno Thyroid, Thyrohyoid. So we'll see, then we have the Sternohyoid and we have the Omohyoid in this. So first we are going to cover about the boundaries and then the content. Most of the question which come in the examination is basically from this part. Whenever we talk about the muscular triangle, no one is going to ask you about boundaries, but the MCQs come from this only. So we are going to focus mainly on our infrahyoid muscles only. So for infrahyoid muscles, first of all we'll see the boundaries of muscular triangle. First point, it has a anterior boundary, it has the posterior, superior boundary, and it has the posterior inferior boundary. So we make a map or a direction, that is superior, inferior, anterior and posterior. If you remember, in the digastric also we have made such map, and that makes your learning easy. So here how we can learn this part? First we say it has the anterior boundary, then we say it has anterior superior. So this boundary, and posterior inferior this boundary. And now we are going just to add the muscles in this part and our entire boundary session will be over. Guys, if you need the standardized note, so do ping me on the WhatsApp or Instagram. I am giving the customized notes also. For head and neck, there is module complete on this part. It is a module 3rd. So if you want to do, ping me about the more information. So for anterior triangle, we are talking about anterior triangle, okay? Sorry, not anterior triangle, the anterior boundary. So anterior boundary is made by the anterior medial line of neck. From where? From hyoid, that is a bone, to sternum. So first part is clear over here only, that this is superior, inferior, anterior, posterior. In anterior part, which thing we need to put? We need to put first hyoid and sternum. Now moving forward, when we talk about the posterior superiorly part, so here it is very easy. For posterior superiorly part, the muscle which come is superior belly of Omohyoid muscle, whereas for posterior inferior part, it is our sternocleidomastoid, that is anterior border. Now we'll make a mind map over here. This is superior, this is inferior, This is anterior, this is posterior. The anterior part we have already seen is formed by our hyoid bone and sternum. Okay, now when we talk about which, the posterior superior part. So this water is formed by superior belly of Omohyoid, whereas posterior inferior part, this part, this is formed by sternocleidomastoid muscle and its interior border, or you say the anterior border of sternocleidomastoid. So this is the complete boundary which you need to remember. Now moving forward, we need to see the muscles. I have already said that infrahyoid muscles are 4 in number. Okay, for 4 in, first is Sterno Hyoid. Then we have Sterno Thyroid. Then we have Omohyoid. And lastly we have a Thyrohyoid. So how to remember these things? It is as the name suggests. Okay, let's start with a very basic. We have sterno and we have hyoid. So in this there is some relation with our sternum part and a hyoid part, as the name suggests. Similarly with this muscle, that is sternothyroid. So here also sternum and thyroid is present, whereas we have omohyoid. Okay, and lastly we have the thyrohyoid. Thyro means thyroid and the hyoid one. Now let's make it more easy. First we have the sternohyoid. For sternohyoid, as I say, it has some sternum part and it has the hyoid part. So we say that we already know that the sternum has manubrium part. Okay, so when we talk about its origin, so first we write it over here. Origin is from our manubrium. Okay, and medial end of clavicle, whereas its insertion, so in the insertion we say that hyoid bone is involved in this, so we write it, insertion is in lower margin of hyoid bone. So in the examination, if you do not remember where is the origin, where is the insertion, just see sternum is there. So which part of sternum? Manubrium is involved in this, and the insertion is in hyoid bone. Now its action. When we talk about its action, it is first it depress larynx and hyoid bone. In which condition? The condition involved is if the mandible is fixed, like if the mandible is not moving, and the another function it can be, that is it can flex our skull. So sternothyroid we have completed, and the lastly is its nerve supply, that is cervical spinal nerve, and that is from 1 to 3. So the nerve supply for sternothyroid and lastly the omohyoid are exactly same. So just copy, cut and paste in the nerve supply of these two muscles. Moving forward, our second, that is sternothyroid. So as the name suggests, some part of sternum is there, and some part of thyroid part is there. So first origin, right? Origin is posterior surface of manubrium. Then insertion, the second part of this is thyroid part. Insertion will be in the thyroid cartilage. And lastly, its action. What is its action? It usually pulls our larynx and hyoid. So it pulls thyroid cartilage inferiorly. And I say nerve supply is same as cervical spinal nerve. ठीक है. So this is the complete easy to learn part. Nerve supply is copy cut paste. Origin is from sternum as the name suggests. Insertion is from the name as the name suggests. Only you need to remember is its action. Now we have the omohyoid part. Omohyoid. So its origin will be from scapula. Omo part, okay, and second part is hyoid. So its insertion is in hyoid bone, lower border of hyoid bone. Moving forward, its action will be depress hyoid bone, and its nerve supply is same, cervical spinal nerve. 1, 2, 3. So copy cut paste from the name suggests, only extra thing to memorize, and origin is also simple. And lastly we have our thyrohyoid part. So thyrohyoid part, first part is thyro, so its origin will be from thyroid. Then we have insertion, second part is hyoid, it will insert into hyoid bone. Now its action will be depress hyoid bone. Another muscle which depresses hyoid bone is omohyoid. We have already seen in this part. See, depress hyoid bone when we talk about omohyoid. Then its nerve supply is first cervical nerve via hypogloss. So this is the thing we need to remember while studying this. See, it's so easy to memorize these infrahyoid muscles. Just see the name, put the origin part, put the insertion part, just learn the action. Even you can do one thing, you can make a note. You can make a note that in action, depression of hyoid bone is by two muscles, that is omohyoid and thyrohyoid. It is so easy to remember this. Now this part is easy to remember. Moving forward to our next triangle, and the next triangle is submental triangle. In submental triangle we need not to mug up maximum thing. Only things which we need to remember is first boundaries, then we have similar like roof, then we have floor. In the floor, copy cut paste of digastric part only, and fourth is content. Okay, so for boundaries, started with boundaries. in the boundaries part, first we have a base. Base is from hyoid bone. Then we have an apex. Apex is by symphysis menti. And lastly, for the side part, we have anterior belly of digastric, that is submandibular triangle. This is its boundary. Then we have roof. Roof is by Omohyoid muscle. Okay. Floor, as I say, copy cut paste. How? It has a skin. It has a deep fascia. It then this. After this, it has a superficial fate. Don't do like this. We'll make it in a more simpler way. See, we have the skin. After skin, we have the superficial fascia, and the superficial fascia contain our muscle, that is platysma. Now after this we have the deep fascia. So it is easy to remember. Now in the content part, second, we have done with our boundaries. We have done boundaries. We see the roof. Roof is very easy, that is Omohyoid. The floor, that is skin, superficial fascia containing the platysma, and the deep part. And the content is content. In content we have anterior jugular vein, and the second one is submental lymph node. So this is the part for submental triangle that we need to learn while studying the submental triangle part. I hope this is clear for you. For this, for our first, that is muscular triangle. In muscular triangle we see that the most important are these 4 muscles only. The 4 muscles are very important part. Now when we see the submental part, in submental we say that submental triangle, in submental triangle only boundaries and roof part is important when we talk about submental triangle. So guys, this is everything which you need to remember. This is very basic, that might come in your exams, that might ask in your exam. So just be prepared with this, that make your study really easy. If you want, we can make submental triangle diagram. So this is our submental, red one is submental triangle. Okay, now let's see the boundaries of the submental triangle. Down here we have our hyoid bone, here we have our mandible part, or we say the midline of the neck, mandible part, and this here this part is our Mylohyoid. So this is Mylohyoid. This is our triangle, that is Submental Triangle. This is our hyoid bone, and this green one is our anterior belly of digastric. So here we see its content only. Hyoid bone, that forms our base. Then we have the anterior belly of digastric, that is on the side, and roof is formed by the Mylohyoid nerve. Similarly, in this diagram, roof is formed by the Mylohyoid. Okay, then we have our base. Base is formed by the hyoid bone, whereas the sides is this side, the green one, is formed by the anterior belly of digastric. So just try to memorize this diagram and you come to know that the content of the submental triangle will be really very easy. This makes your learning extremely easy part. So guys, that's all we need to remember when we talk about our muscular triangle, right? For muscular triangle, you can make a diagram. Here we have this mandible part. This one is our superior belly of Omohyoid. This yellow part is our Sterno Thyroid. Then this is our Sterno Thyroid, and this one is our Thyrohyoid. So you can make the diagram like this also. It makes your learning easy. Just this superior belly, next to the superior belly is a Sternohyoid. Then we have this, that is Thyrohyoid and Sternothyroid. Just easy way to remember. So guys, that's all for today. We have done 3 triangles, that is digastric, muscular and submental, and lastly the triangle which is left, it is carotid triangle, and soon I am going to post about the carotid triangle also. Guys, hope you like the video and the content of the video. Share. So guys, please do subscribe, please like if you like, please like and share with your friends, and if you need any notes, so do ping me on WhatsApp or Telegram. I'll be sending you over there only. So guys, that's all for today.